physicians and healthcare practitioners, chiropractors, orthopods. We're very non-discriminating in that regard. Who will help each other and help us. And so this is the resource you have. So I encourage you to, in your bulletin and your booklet, and also online, you'll find there's a link to the Performance Healthcare Committee. And this is for you. And so if you have questions, if you have problems, there are resources there. They'll tell you who you can contact, what website can you go to, anything except TikTok. And so, and you can even send questions in and also information in terms of what you would like to have here next year. And that's how we ended up doing this. So next year will be Portland, Oregon. Wonderful rose gardens out there, beautiful site. And so most of you, I hope you'll go. And then if you tell the organization now what you would like to hear, we've got a chance of developing something for you and meet your needs. So with that, I'll start off. We have 3 presenters here who are members of the committee. Myself, Steve Mitchell, I'm a otolaryngologist from Nashville, Tennessee. I got roped into this nonsense because my wife's a flutist and I had to. Sound familiar? Your door monitor is in the same fix I am. But it's one of the things, is a labor of love. And I've got Angela McCuiston, who was our previous chair of the committee. And she'll introduce herself. And then Chip Shelton, who is a dentist and an orthodontist. And so all of us have been involved with this for one reason or another. And so we want to talk to you a little bit about the problems of the aging flutist, which is appropriate because most of us are aging and maturing. Not all of us. However, I have something special for you guys who think you're young. So one of the things that one of my favorite flutists came up with, Hans, he said, it's undeniable that the practice of the flute requires as healthy a body as the athletic pursuits. For a long time, this is unappreciated. And we learned from when we started the Performing Arts Medicine Association a number of years ago, we found that the jocks were well funded and the musicians weren't. And we had problems with the dancers and instrumentalists who had no funding for their organizations, and the athletes that are bulging with hands. So we basically robbed all the information we could from them, and we've used that model to help develop these things to serve the needs of groups that we love, which are flutists. One of the things that's going to happen, and I'm sorry, but I can't do anything about it. Age stiffens the joints and thickens the brains. The life expectancy could change. So over the last 120 years or so, males are hanging around for an extra 30 years, and females almost an extra 40 years. So consequently, we got more people who are going to be aging, and about 16% of the population is over the age of 64. And I don't see any signs of that changing. So there's no stopping the aging, literally no viable alternatives. And so some of the flutists are going to be stressed by inadequate retirement or medical plans, which means you may be forced to play a lot longer than you originally planned to when you were very young. So how are you going to reduce the ravages of time since you can't get rid of it? Well, first of all, good genes. Good luck. This is not a commercial for genes. But good parental selection is vital. You want to have a healthy diet, a sensible exercise. One of the most important things is what I call the stitch in time with quality medical care. Emphasize the word quality. We'll get into that in a little bit. Keep active in body and mind. Those are critical. So here are some of the body parts that I'm going to cover that are affected by aging. Wind, embouchure, hands, muscles, posture, vision and hearing, mind and nerves. The wind and the aging. As we age, whether we want to or not, the rib cage stiffens. And as it stiffens, it reduces its expansion and limiting how much we can exhale. Guess what? That means you got to move your breath marks. COPD, which is a curse, is chronic obstructive pulmonary disease. It comes on after about age 35. It can be inherited, so you can look to your parents to see whether or not you're in line. Often due to smoking or aggravated by smoking and air pollution, which I don't advise. And it's helped by respiratory therapy, exercises, medications. But the main thing is that playing the flute is good for you. The more you play the flute, the better your lungs are going to be. And so that's the #1 physical therapy. You don't need a blow bottle. You don't need all these special therapists. And if you've got a good flute, embochure and aging. This gentleman over here, Chip will cover most of this, so I'm going to skip over that. However, dry mouth. One of the big problems of dry mouth is it affects about 25% of us elderly. And unfortunately, many of the medications that we're required to take will cause dry mouth. And this is your antihistamines, if we got allergies, antidepressants, heart medicines, blood pressure medicines, is helped by warm water, and it's not helped by caffeine. A sugar-free gum can help. Biotine, which is an over-the-counter product, can help. Humidifiers will help. Ginger will help. And if you really get desperate, your doctor can actually give you a prescription of pilocarpine if you can. It works wonders. It's called Saligen. And that can help wonders if you need to. Because a flutist who has a dry mouth doesn't play very well. One of the other things that happens is your tongue will thin. This thing in here, the muscle fibers shrink, which means your velocity will decrease, which means, guess what? Your triple tonguing is going to become double tonguing. And it can mean you may have to kind of set the metronome for a little slower speed sometimes in order to play the piece that you used to play 20 years ago. Exercising the tongue will help. It looks kind of weird, and you may get some odd looks when you're driving down the highway. That can help. But one of the things that makes a big difference is taking rest breaks. And unfortunately, people suffer from what I call jury trauma. They're getting ready to have a jury, and all of a sudden they haven't done squat for months, and now all of a sudden they're blank, they're 23 hours a day, and not taking the rest breaks. Your body doesn't allow that, and as you get older, it's going to get more cheesed off at you if you do. Hands and aging. Anybody got arthritis? Hey, join the crowd. Well, we got osteoarthritis and rheumatoid arthritis are the biggies. There are others out there, but the main thing, about 1 in 7 adults are going to have some form of arthritis, which can cause degeneration of the joint. Most commonly affects the fingers and the base of the tongue, base of the thumb, and it can be related to joint stress and trauma. And guess what you guys are doing all the time? You're traumatizing. Okay. And so over the age of 60, about 1 in 10 of us are affected, but about 18% of you guys, sorry. Now the rheumatoid arthritis, unknown cause for that. They got a lot of guesses on it. Affects the same joints, but it starts a little bit earlier, so around 40 to 60, more in females than males. It affects other organs too. Both of these guys will progress, but they can be helped. And so the catch is to get the help early because they cause degeneration. And once the joint starts degeneration, it's kind of a one-way street. And so what you want to do is try to prevent that degeneration as much as you can early on. And so a rheumatologist can help. They're not magic, but they can help. And if you need them, use them. Muscles and aging. Your muscles have problems too, and you use those. And there's a fancy little word you need to know called sarcopenia. It's a progressive loss of muscle mass. It starts around the age of 45, and it worsens about 10 to 15% per decade up to the age of 70, and then it accelerates up to 25 to 40% per decade. That's not good. It causes reduced endurance, reduced strength, and reduced speed of motion. It can lead to loss of balance and falls and fractures, and trust me, falls are kind of like playing Russian roulette. If you fall at about the age of 70, there's a pretty good chance you may never recover from it. So watch it. It improves with careful exercise and resistance training. Angela over here is going to help you a lot with that because it's critical to do as much of that wisely as you can early on. Changes the diet can help, but they're not magic. Hormone therapy can help, but I wouldn't rely on it. Posture and aging. Our posture would change over time. We get deterioration of the spine and discs, and you have people talking about the Alexander technique and Feldenkrais technique, and trust me, they are very aware of what happens with the discs and spine and things to try and prevent that. You get stiffening of the ligaments and joints, which is why the flexibility in yoga can be very helpful, which we recommend. Shrinkage of the muscles and tendons, that's a real problem. It gets worse, and it can cause loss of balance and more falls. And then you get pain from the arthritis will mess it up, and the lack of exercise. And unfortunately, a lot of us will start to exercise less as we get older, mainly because it's a pain, literally a pain. You get pain in the feet, arthritis in the ankles, pain in the knees, you're on your second or third knee. And so this will cause you to exercise less. And you got to be careful about that. Vision and aging, presbyopia. No, I'm not, it's not, you can be a Methodist and have presbyopia. It just means it's hard to focus on close objects. And you can tell people when the music stand starts moving further and further away. Usually starts around age 40. And you can just wear these little guys. They can help. Cataracts, that's when you get clouding and things get blurry, and you get funny little stars and sparkles when at nighttime when you're driving. You can get age-related macular degeneration, which you don't want, and it affects the central vision and makes reading very difficult. And glaucoma will increase the pressure in the eye and can lead to early vision loss. What it boils down to these is that all of these can be picked up by your eye doctor, a good eye doctor. And most of these can be helped or slowed if caught early. The big trick, you need to go to somebody who actually checks these things. So just going ahead and getting your glasses prescription at Costco ain't cutting it. You're going to actually need to see a real honest to gosh doctor who's going to put that lousy set of drops in your eyes that dilate them so you can't see anything when you drive home. But they'll be able to tell you if you have those problems in your eyes and you need to do it. And so between age 40 and 65, please get one about every 2 years. And after age 65, you probably better get it every year. It'll make a difference for you. Hearing and aging, otherwise presbycusis, another religious edict here. About 15% of the population over 18 have it, and they may not even realize it. Over 65, about a third of us, and over 75, half of us have that problem. And the problem is not only do you have problems trying to hearing sounds and having to turn the volume knob up, but you have problems understanding the words. Ted, read, Fred, dead, said sound about the same because you can't pick up the high frequency consonants. And so, and in background noise, good luck trying to hear anything over background noise. And then you get the ringing in the ears, and you can't tell, okay, which pitch is which. Family history will cause some of it, noise trauma will cause it, aging will cause it, infections will cause it, diabetes, hypertension, all those things were aggravated. So if you have any of those, be very careful about it. The main trick is to avoid excessive prolonged noise exposure. Guess what? And unfortunately, there's been a lot of work done by this, by a lot of organizations, and they've not really had a good time trying to prove workman's compensation due to noise exposure with symphony players. And they've been trying for ages to do that. However, I have a sneaky feeling that piccolo players have more problem in the right ear. So wear hearing protection as much as possible. If you are going to wear hearing protection because of hearing problems, you're going to have to wear it for practice and performance. Because trust me, if you practice without it and also you stick it in for performance, you're going to bite. It's going to sound awful. So you need to get used to using it all the time. If you need any hearing aids, bring your flute. Okay? Audiologists, as a rule, have the foggiest idea what you guys do. They have the foggiest idea what you guys need. And you put a set of hearing aids in that go just great for conversation and play your flute, it ain't gonna work. It'll drive you nuts. And so you bring it in and they can program the hearing aid to work with you while you're playing in the booth. So bring it with you. Mind and aging. Guess what? Our brains shrink along with in size and weight, along with decreased neurons. We're all getting stupid. So 40% of us over the age of 65 will have some form of memory loss, and it's not just finding your car keys. Most of us will have the memory loss without any dementia. So just because you have some memory loss doesn't mean you're going ready for the funny farm. About 5 to 8% over the age of 60 may have some degree of dementia. That doesn't mean Alzheimer's. Okay? So bear that in mind. If you have any questions about memory loss, you're not going to want to do it, but go see a neurologist because medications and therapy can help. You need speech therapy, you may need some form of occupational therapy, you may need some medication. They can help. They're not magic, but they can help. So the key is to stay mentally, socially, and physically active. Okay, if you start becoming a hermit and a couch potato, you're going to go downhill fast. So stay with people. Playing your flute is therapeutic, so please play forever. This is vital for you. This is part of your longevity. This is who you are. And you need to take that flute out, dust it off, even when you're 85 years old, and play it. You do it once a week, that's fine. You play 3 blind mice, that's fine. But do it. The eye, mind, ear, hand, getting involved, breathing, and all that is therapeutic for you. You will live longer and happier because of it. Please do it. So with that, I'm going to turn you over to the person who's going to keep you even healthier. Good
morning, everybody. My name is Angela McCuiston. I'm a certified personal trainer, corrective exercise specialist, and senior fitness specialist. So I specialize in injury prevention through strength training. Why exercise is crucial as we age? Well, you can see the laundry list of things. It's not just about your muscle. It's also about your confidence and preventing dyspnea. It changes your resting heart rate, your blood pressure, prevents diabetes, can actually reverse diabetes. It's the fountain of youth, really. And also, being unhealthy is kind of expensive. The American Association for Retired Persons and the Administration on Aging report that in 2006, only 39% of older people rated their health as excellent or very good. And 85% of older adults suffer from at least one chronic health condition. In 2005, this accounted for 57% of the nation's total healthcare expenditures. And that totals $362 billion. That's 12 grand for every older adult. So Medicare is not going to be able to handle everything, so it's up to us to take care of ourselves, right? This is real. I know, the grip test. So, you know, when you have a baby, you always give the grip. Well, this is how they used to test it. How healthy is your child? So, if you notice as you age, if your grip strength is lessening, it's actually linked to longevity. So strength training can actually increase your age longevity. So some considerations for strength training. You've got your warm-up, you've got self-myofascial release, we follow that with static stretching, dynamic stretching, and then you strengthen with feet. So we call this, there's a continuum, and the way that I do it is in that order, because when you've got muscles that are tight and they're inhibiting other muscles, you can't force a weak muscle to just turn on. You have to get the overactive muscle to calm down before you get the underactive muscle to chip in. So, this look familiar? We bring ourselves to the flute instead of bringing the flute to us. Over the years, we get what's called a dowager's hump. That can happen. It's not attractive. Nobody wants that. Right? So these kind of muscle imbalances can exacerbate over time. They can cause pain. They can cause real problems. But the good news is soft tissue is soft, and we can change that. So we've got a couple of neck stretches. And these work. Apologies for the cheesy music. But some of these neck stretches are going to be really helpful for you before you play, after you play. We've got 3 different neck muscles that we're going to be talking about. We've got the upper traps, We've got the levators in the back and the SCM right here. So if you'd like to, we can do all of these. However, as we're doing these, one side is probably going to be tighter than the other. And that would be your SCM, and that's how you stretch it that way. So if you'd like to try these, the SCM on the right side is probably going to be tighter. So if you think about how you play, we turn our heads to the left, and we go this way. This muscle does that, and so that means it's going to be tight on the right side and loose on the left. Not loose, but it's not going to be tight, right? So to stretch your SCM, what you're going to do is you're going to take your left hand and put it right above your right eyebrow, and then you're going to gently pull back. It should feel really nice, right? Gentle. Gentle is key here. Nobody wants to be, yanking your head backwards. But you should feel a really nice stretch right through here. If you want to make it a little more effective, gently press into your hand for 3 seconds, about 5% of what you can do, and relax, you should go farther. That is your SCM on the right side. Your upper traps on the right side, you're going to take your hand and go left ear straight over to your left shoulder. Again, very, very easy. Should feel nice. And I want you to try the opposite side too. Is one side tighter than the other? Right? So, and then you have your levator scapula on the back side of your neck. And so what you're going to do is you're going to put your hand on your left hand on the back right side of your head. There's a lot of crossing going on. You're going to look down towards your left foot. Isn't that nice? And you'll feel that goes right up along your shoulder blades and then relax. So those are my 3 favorite neck stretches. Oh no, we're done with that. Okay, so we've stretched, but now we have to strengthen. So this is something that you can do anywhere. I like to do this in the car while I'm driving. So if your headrest is right there, all you gotta do is anybody done a chin tuck before? Yeah, you look like John McCuiston. It's not a good look. That means you're doing it right. So if you tuck your chin slightly down, pretend like your chin is on rails, you're gonna slide it straight back. Give yourself that beautiful double chin we all don't want. And if you're pressing into something, you'll feel a little bit of resistance. So like this person has, if you think up and back and you gently press in, you'll feel a little bit of resistance. That's an easy thing that you can do before, after you play, while you're driving, be safe. And then we've got my other 2 favorite neck exercises. They look ridiculous, but they're very effective. How many of us have TheraBands? Right? We've all been a PT at some point. Flat band. And so this is one of my favorites. So you're going to take that band, wrap it around your head like a headband, but you're going to pull it to the left. You're going to do that chin tuck and then go to the right. So you're going to get resistance on one side. Right? Same with the other side. You're going to chin tuck back, and you're going to go resistance again back. The other side. Okay? And then this one, again, that's that same chin tuck, but we're going against gravity and gravity band. So this is something that you can do on your bed. Really, really easy. All right, then we get into core and balance training because, like Dr. Mercer said, falling is a bad idea, especially as you get older. I don't know how we did it as kids, but as we get older, it's a really scary thing. And it's just something we want to avoid. So when you're going to start your strength training, these are the reps you need to keep in mind. If you've not done it in a while, that's totally fine. And strength training is appropriate for every age. I don't care if you're 8 years old or you're 80 years old. I think my oldest client I had was 83. She was just fine. Everybody in my gym is going to learn to touch a barbell, just because there's something really empowering about it, right? And that resistance training offers us a whole lot of benefits. But you're going to start with 1 to 4 exercises, 1 to 4 sets of 12 to 20 reps, but you're going to do it slowly. Slowly is really, really key here. So we're just talking about falls. We've got some scary stats about that. 18 million emergency room treatments, 400,000 bone fractures, and 16,000 deaths just from fall injuries. It's really something we want to avoid. The thing is, if we don't train, we don't think about training our balance. But if you don't do it, you lose it. You notice like when you were a kid, you'd hop around on one foot like all the time. I don't know if I would do it, but we're all like constantly, right? When do we do that as adults? And we don't, right? So one of the things that I tell a lot of my clients is, hey, while you're brushing your teeth, I want you to stand on one foot. And you're not just standing on one foot. The key is, when you stand on one foot, try to squeeze your arch. You can do it while you're sitting down. Can you squeeze your arch? You should be able to. But when you stand on one foot, you lift that arch, you'll feel your core engage as well. And suddenly your posture's better. And it's a full body core exercise just from standing on one foot. Okay. So some of my favorite core exercises and their progressions, we've got, you go from bridges. Everybody know what bridges are? It's the goofy one where you're lying on your back and you lift your butt in the air. Well, if you're doing 2 legs, you go from 2 legs to 1 leg. Dead bugs, you're doing it's the goofy one where you look like a dying cockroach. You're doing this. You go from that to you're doing it held offset. So these are some of my favorite progressions. Oh, yes.
Yeah, so there's one on there or one that's not on there, but I read about something called the scorpion stretch. And then I come up and demonstrate.
Oh, sure.
I mean, just you can see it. I have to be on the floor to do it, sorry, but it's kind of like, I don't know, so people in the back can't see it. It's sort of like, get on the floor, and what I vaguely remember, it's sort of like, oh yeah, and they grab like that. Yeah.
Yeah. I've done those too, where you go.
Yeah. Oh, sure.
Okay, so we're talking about for core exercise again. So we've got, these are bridges. As you can see, she's doing she's doing a bridge, but she's adding resistance, and now she's doing 1 leg at a time and keeping your hips stable. This is really good for flute players because it does offset from one side to the other. You know, we play an asymmetrical instrument, so asymmetrical strength training is really, really good. So this is one way to be able to progress this single exercise. You can progress it. And you should always be progressing your exercise. Just doing the same exercise the same way, 20 reps every single day, is not going to give you the results that you want.
Can you wind that one again?
Yes.
I take a video.
Sure. And I have all of these on my YouTube channel as well.
Oh, great.
Yeah. You see how her hips are stable? They're not dropping. That is harder than it looks. Yeah. Everybody's like, yeah, it is. All right. This is Howard, one of my clients. These are all my clients. He's not in pain, I promise. He just refuses to, he just loved to make that face. I tried to get him not to. This is really hard. I'm like, you okay? I'm fine. You know, he just made him feel like he was working hard, I think. So what's key about this is Howard is doing these balance exercises, but you can see he's got some stability with it. So he's doing a 1 leg balance with a 1 arm curl, but he's got something there just in case if he doesn't fall, just in case. So he's doing these Bulgarian split squats, but he's got something there for balance, right? Oh, well, he's Howard. I really wish he quit making that face. So there's ways that you can progress your strength training at home in the gym, but you can still be safe about it. All right, so real quick, we've got Flutist problems. This looks familiar, yes, but you can see how this is Katie Metz, by the way. If you guys came to the presentation in Chicago, we did a whole presentation on asymmetrical strength training. And you can see these are the problems that can happen if you don't train for strength. So these are going to be exercises, these are guidelines. These are the things that you want to be doing. Compound exercises are fantastic. Rows, deadlifts, step ups, step downs. Stable, you want to start with stable and progress to unstable. So these are some of my favorites for flutists. Real quick, I would like to have everybody learn how to do a box squat using your chair. So if you stand up real quick, all we're going to do is you're going to stand right in front of your chair. I want you to put your fingertips in your hip joint. Okay? Right where your legs meet your body. Now press. Your butt should go back. If it doesn't, something's really wrong. Right? So this is the hip, this is the joint. This is where you should be hinging from. Now are your knees locked? Because they shouldn't be. We're going to look real ridiculous. You're welcome. So I want you guys to all have soft knees. You're going to push your hips back. I want you to pull in your belly button. And hold that and sit. You notice where your weight is? And then come back up. Your weight should be on your heels to your midfoot. It's not on your toes, right? Great. So I want you to hold that. You're going to go all the way down to the chair. Come all the way up. That's a box squat. Congratulations. You can sit down. But you can see how it's also a core exercise. Because you have to hold this. Next time you do it, try lifting your arches. Okay. So when you're deadlifting, something to notice, this is my client Angel, she's 73. She's deadlifting. One thing I want you to notice with her versus the other person is that she's trying to pick up the weight this way. So this is something, when you're learning how to deadlift, deadlifts are not as scary as they sound because it's literally picking something up off the floor. Who has grandkids you pick up off the floor? Right? Who has groceries that you pick up off the floor? Right? Exactly. We have all kinds of things we need to pick up off the floor, so it's a life skill, right? But I want you to look at how she does it. So this is my client Jason, who's an audio visual tech and a bass player. It was only about 335 pounds. He was like, yep, that's a PR. Yeah. He was very excited. But you'll notice he's using his whole body to pick it up. So that block spot you just did, the same thing with a deadlift, your weight's gonna be in that same area, right? So if you'll notice when he does this, look at his shoulders. They don't go anywhere, right? But when Angel does it, she's trying to finish the move. And honestly, I was very excited for her. So the heavier the weight, the less chance you're going to do something like that. So having some extra resistance is actually a good thing. Okay, so, and this is my other client, Diane, deadlifting. She's 73. If you're going to do a deadlift, like I said, they're not as scary as you think, right? The things you need to know, you're going to pull the bar towards you. You're going to push the floor away from you and then stand up. That's really it, right? So that box spot you just did, you're going to pull towards you, push the floor away to your heels, stand up. That's it, right? So they're for everybody, and this is Diane deadlifting, her body weight, because she's only maybe 90 pounds. So this is Diane. She came to me, there she is. She came to me because she had osteoporosis. She had osteopenia, and she wanted to reverse that if at all possible. And you can see from what she said that she wanted to improve her bone strength and her flexibility. Her osteopenia had already progressed into osteoporosis. We've been training for 10 years, and it's now gone backwards, which is wonderful, right? Because nobody wants osteoporosis and to break it at the drop of a hat. So she's 75 now. She's not in. She's back in the osteopenia range, and strength training is really wonderful for that because you need that resistance pulling the muscles pulling on your bones to create that bone, and it's never too late, right? So it's for everybody. So last thing, when you are strength training, even if this is your first, you're going to start now. What you need to do is you need to keep a log because you want to progress. Like I said, if you're doing the exact same exercises, it's better than nothing. But you should always be adding a set, adding a rep, adding a weight. Or adding instability. You should always be progressing somehow. Otherwise, you're not really making any progress, right? And again, don't be afraid to train your grip. Remember the baby picture? That's a very healthy baby. The stronger your grip is, the healthier you are, and the longer your life could be. So those are my final thoughts. Here's how you can find me if you need to. And with that, I'm going to pass it on to Dr. Chip. Thank you very much.
If you go back to that last slide for a minute, please, you are good. Thank you.
5, 4, 3, 2, 1. Let's see. All right. Let's do that.
Does anybody have any questions about these slides? Yes.
Whenever you're training your grip strength, sometimes whenever I'm lifting weights, I'll feel the hole in my chest a little bit too much. And I'm okay.
Yes, I don't really training grip specifically or just gripping.
Usually just weights in general.
Okay. Let's talk in a little bit.
Yep.
Oh, I thought you were answering.
Oh, we're good. We're good.
Okay.
Yep. Okay.
Do you have some suggestions about how to find the right kind of a trainer that would
be good for flutists, or I suspect some might not do what we need?
Sure. The best thing you can do, bring your flute in with you to the gym or when you're gonna interview your trainer, because you should interview your trainer, right? You don't just blindly pick one, right? The certification that I have is from the National Academy of Sports Medicine. Anybody who has a corrective exercise specialization would be a good place to start because they're already trained to look for muscle imbalances. And you bring your flute and you show, they're gonna check your posture and then they'll go from there. Sure.
Good morning, everybody. I'm Chip Shelton. I practice orthodontics 3 days a week, basically 39 years. And the rest of my time was spent in music and trying to keep in shape in athletics. I have 11 critically acclaimed recording releases and 14 years retired, and I'm still having fun. So let's start with a vocalization exercise. How's everybody feeling? If you're feeling real good, say yeah. Yeah. And if you're looking real good and you know it, say oh yeah. Oh yeah. I think I agree. So, daily orofacial maintenance is highly recommended for effective flute playing, especially if you're maturing, including ongoing attention to teeth, orofacial muscles, jaw joints, neck, shoulders, upper body. And let's run through some quick basics. Something above there that we don't see. How do I, oh, maybe I do that. No, that didn't work.
That's all right.
It's all there?
Yeah.
Oh, okay. All right. So the most common oral diseases that daily care helps protect against are cavities and gum disease. So sugary foods and drinks produce acid that causes cavities or decaying of the tooth's hard surface known as enamel. So if we don't remove plaque with daily cleaning between the teeth, the gums can pull away from our teeth and allow plaque to get below the gum line, causing breakdown of connective tissues and bone, and this is professional term for that is periodontitis, inflammation around the teeth. Gums that bleed when you clean your teeth is one sign. Another is gums that recede or pull away from the teeth. Another sign is chronic bad breath or bad taste in your mouth. So we should brush our teeth for approximately 2 minutes at least twice a day. And especially before bedtime is very important. If you only get one brushing in, before bedtime, it's better to go to sleep for 7 hours, 8 hours, without the bacterial action that goes on if you just leave the teeth unclean overnight. So use soft bristle brush usually so you can vigorously brush at and the whole tooth and at and beneath the gum line. And fluoride toothpaste is great to prevent the decay of the tooth enamel. And there's no danger in using fluoride toothpaste if you don't swallow it. So spit it out and rinse after. A question.
Not a question, but it didn't say up there, but I remember reading it. I've actually still doing that. Like when you brush your teeth, don't spit it out, but don't rinse, like keep the fluoride on your teeth. And
No, well, there are fluoride rinses. I don't use them, but when you're brushing with fluoride toothpaste, I was just indicating that don't swallow the toothpaste with the fluoride in it. If you do it once, it won't harm you, but if you do it twice a day, it might.
Right.
I don't know.
I think what I'm saying is that, like, after you finish brushing, spit, but don't rinse to allow the fluoride to sit on your teeth. That's.
Well, I rinse personally. Yeah. That's a very good question. Do you leave some in there to let it do its thing? Is that what you do?
I
Yeah.
started doing that more recently.
Okay, well, another question.
Here's some new thinking that I've heard, which you should not brush right after you eat. You should wait a half hour because the acids actually soften your tooth enamels and you're actually brushing your tooth enamel off if you don't let your saliva work for a half hour after a meal. What do you think about that? Do you agree with this new thinking? I used to brush
That
my
is
teeth
new
right after.
thinking.
I used to brush my teeth right after, and just
Yeah.
recently was told, no, don't do that, wait a half hour.
Half
And then I
hour?
went online
Well-
And it said, wait a half hour.
Half hour is a very short period of time, so it sounds like it can't hurt you to wait a half hour. Yeah, but that's new thinking. Thanks. Yeah. So, let's talk about oral care. Continue. So we want to, not only brush the accessible surfaces, we want to get between the teeth as well with handheld dental floss. We have floss holders for, that assist us in not having to use the stringy dental floss. And I use both an interdental brush between the teeth, especially because I have a bridge here, and you can't put floss in if you have a bridge replacing the tooth. So interdental brushes are great. And I also use a water flosser. Those things have been around for a long time, but they're much more effective in recent years than the original ones were. The original ones were very gentle, but yeah, the ones nowadays, I got some brochures around here somewhere. But anyway, again, sugar causes cavities and contributes to periodontal disease, and it's important to limit sugary foods and drinks. Can't say that enough. Regular dental appointments. Check your mouth for signs of disease. Professionally clean your teeth at and beneath the gum line. There. A waterproof company for decades has made a water flossing machine, but the ones they have now called Sonic Fusion, that's the one I use, and highly recommend it. Braces. How many raise your hand if you've had braces while playing the flute? Oh, wow. Yeah, that was a revelation because I got my braces as a practicing orthodontist. And I wrote articles for Flutist and other people about my experience, and I published in dental journals about what it's like as a patient, what we're putting our patients through. I was surprised how uncomfortable the braces were at first. Major discomfort for quite a while. Tone and articulation on the flute usually returns after a few weeks adjustment period if you persevere. And I really got into the clear removable braces, Invisalign, etc. Because of my personal experience having the braces. I really made an effort to master that technique. So if you're going to go for Invisalign or similar products, interview your orthodontist, and he or she has done a lot of cases, hundreds of cases. Then they will have the expertise to treat more complicated orthodontic problems. Good question there.
You answered it with what you said. Thank you.
Okay. Chip Shelton, email me if you'd like to have a copy of the Flutist Quarterly article that myself and 2 other flutists wrote, all of us having had orthodontic treatment. Prevention, self-care, and avoiding pain of temporomandibular joint dysfunction and overuse syndromes. TMJ is if you put your fingers in front of your ear hole and open and close, you'll feel the joint, the hinge joint that this refers to. And it can be a painful ailment to have TMJ problems. Anyone here, raise your hand if you've had temporomandibular joint dysfunction. Yeah. So when you're in pain or if you're in an acute time of having pain, probably you don't want to do exercises. But when you're feeling fairly healthy, you can do gentle jaw stretching exercises, which can exercise the temporomandibular joint and muscles, so that you're less likely to have worsening temporomandibular joint issues. So opening and closing side-to-side movements of the jaw, and as Angela probably covered, some neck stretching exercises, side-to-side exercises. Try to touch your shoulder with your ear exercise on each side. It's my daughter when she was in high school. She was my guinea pig. And yeah, so now she has 3 of her own. So what's this? 1994. How did I get in there? Okay. Okay, if you're having an acute TMJ episode, chew as little as possible. Liquids, semi-solids are best. Soft intake until the pain subsides. Give the area a rest, for goodness sake. And no gum chewing, especially if you're in TMJ pain. Ideally, I would recommend chew as little gum as possible as a lifestyle. And when you're having symptoms, you can treat it like an athletic injury with cold compresses, hot compresses, and even better probably is to alternate. Start with cold to hot. If you alternate more than once, always finish with cold. Did you agree, Steve? Yeah, okay. Avoid activities that require you to open wide. Even postpone dental visits when you're in episode of TMJ pain, because the dentist, what's he going to say? Open wide. Let me get in there, he or she. If you have a grinding or clenching habit, that could be cause things to worsen with your temporomandibular joint. And they have rubberized mouth guards you can probably purchase online or at CVS that can help with that. Or the dentist can make you custom items. Who's this guy? Oh yeah. I started out by telling you that I kind of balanced my music love and athletic love with my need for having a decent lifestyle by practicing orthodontics for 3 days a week. So when my son finished grad school, how much time we got?
A minute or two.
Minute? Okay, okay. So my son finished, he worked in my practice. He finished grad school, but he didn't go into orthodontics, but he came and worked in the practice to help me get it ready for selling, which one of my former students bought it. He kept telling me, I had no idea what you do, how he had visited the practice many times, but being there every day, his mantra was, you gotta write a book. You gotta write a book. And his sister, who has a master's in creative writing, you gotta write a book. So I said, okay, you two are going to be co-writers. So I fed them the information, and they put it all together. So again, if you're interested in, if you are a dual career person or you know someone who aspires to it, this will help you to understand how to make it work for yourself, because it ain't easy, especially, anyway. Thank you so much. Steve said, direct all questions to him. Who's the question for?
For you.
For me?
If you don't have TMJ, do you have any thoughts about chewing gum? If you don't have TMJ, is it a good thing or a bad thing? Share with us now.
Steve gave gum a thumb down, and I agree. Yeah, it's overworking the muscles. It's probably got sugar in it. It's overworking the apparatus, and you can get away with it for a long time, but it could cause problems eventually, right? Yeah. Okay, I see, oh, there's another question in the back.
Yeah, are these PowerPoint slides available anywhere?
Are these PowerPoint slides what?
Available.
Available. I hadn't thought of that.
Well, yeah, they're on a flash, they're on my flash drive. Hey, there it is. Okay. No. We'll talk to the Performance Healthcare Committee and see whether or not they can make it available online. If motivated enough, we may actually put an article in Fluist Quarterly covering all this.
Yes, ma'am.
How do you manage angulation of the distal phalanxes with arthritis in the aging flutist?
Well, it's tough, it really is. And you sometimes have to see one of our flute makers back there and make little modifications in your flute. And that's entirely possible. There are little additions you can put on your flute or have something put in your flute, which allows that finger, which is done over here, to be actually hit the key. And if you have to do that, it's a piece of cake. You know, the whole idea is the flute, like a lot of things, is one size fits none. Okay, so what you can do is go ahead and have somebody fit the flute to you and put the little modifications on it. You can also change flutes. Some people, I've had some people who had a horrible time with the C flute. They did great with the contrabass. Okay, so you can modify which one you're playing, but you can modify your flute too. There are guys back there who are making a living selling things that make it so that you can play your flute.
If you haven't tried the alternative head joints over at Flute Specialist, go give those a shot. They're pretty amazing. Oh wow. Yeah.
Two questions. Are there exercises that can improve when your arthritis has twisted the joint? And how do you feel about taking something like naproxen on a regular basis to prevent your arthritis from distorting your joints?
It doesn't necessarily prevent it, but can make it feel a whole lot better. There's a big debate on how much the anti-inflammatories prevent the scarring that will cause angulation of the joint. You have to be careful with it. You can get some really nasty ulcers with that stuff too. So the less medication you take, the better, if you can. But you know, once angulation starts, is there any exercise to do it? Not really. Not really. That's one of the things we talk about, not banging up your hands early on. Like, you know, for those of you who are playing handball, don't. Okay? You want to prevent the big trauma up front as much as you can. Because after that, you're talking about getting your E key bent a little bit for you.
Do you have any stretches or exercises for Dupuytren contraction?
That's yours.
Explain what that is. It's a tightening of the fascia.
Use the mic. Use the mic.
Sorry about that.
Caveat, I am not a certified hand therapist. That is a certified hand therapist question. However, no, I don't. Sorry, because what I can do, I can talk about the muscles of the forearm, which can cause issues in the hand and the wrist and carpal tunnel syndrome and all of that. But how do you even say that word? Dupuytren. I've gotten that question before, but unfortunately, no. I have a friend who's a certified hand therapist. I'm happy to give you her information. They can do, I think they give injections into the, but it is a thickening of the sheath of the fascia there. And actually, a hand surgeon is a good person to talk to, because a lot of times we don't want to go to hand surgeons because we're afraid they're just going to cut us open. But I have a good friend who is a flutist and a hand surgeon. And she's the first person to say, hey, come see me, because a lot of times I will tell you, you don't need surgery, but you can go do these things. So there are good resources to check as well. Sorry.
Yes, I have, based on kettlebells or hand weights for flutists, is there a low weight start? My husband has some kettlebells and all the different weights,
So you're asking, is there a certain weight you should start at?
Start at, especially because I do play all the different types of flutes. So.
Sure. It depends on what you're going to be doing, what exercise it is. The point with the weights on the exercise is that you definitely want to pick something that is going to challenge you. So if it's not enough of a challenge, it's a little bit of a time waster. So it really depends on you. But it also depends on the exercise.
Do you hold the kettlebells a certain way that, as far as this way versus this way?
Well, again, it would depend on what exercise you're going to be doing. But if you're like overhead, you want the kettlebell on the back of your wrist. You want to keep that wrist straight. You don't want to be doing this, right? So if you're pressing overhead, you don't want to go that way. You want to go this way. So think about that kettlebell is going to bring you back. You want to bring like you're knocking on the door. You're going to bring that wrist forward. It's not you're not pushing up this way, but it will help you keep that wrist straight.
Thank you very much.
Do you have any recommendations for somebody that has like early carpal tunnel with like low flutes? Because I do have a base that I hold up. Any exercises for that?
Yes, absolutely. I've got a whole lot in my membership and on my website. We can talk about that later, but you want to keep the muscles of your forearm happy, because a lot of times when carpal tunnel syndrome starts, the muscles of the forearm get inflamed, they get swollen, and that causes swelling in the carpal tunnel. So if you just start here, it's a good way to prevent that, and then strengthening the muscles of your forearm as well. So I can show you that afterwards. Thank you.
We have time for one more question before we hit the gong. Yes.
Vocalists have this issue too that I've noticed as getting older, the slowing of my vibrato. Is there something exercise-wise, a muscle that I should be focusing on, something else other than incessant vibrato exercises which help, but not where I used to be?
The short answer is no. Yeah, because even the most famous opera singers have had the same problem where their vibrato starts ephemerizing and starts spreading out more and more and more. There's not an awful lot you can do about it. They've tried, so you can practice, and your singing voice teacher may help a little bit tweaking, but it's just the mechanics of the soft tissue in and around the larynx area, they're changing.
Does core strengthening help that?
Won't hurt. Won't hurt. And that's an important thing, is that it won't hurt. So all the things that don't hurt that we're talking about, they help. But they're not going to just help you play your flute. They're going to help you live your life. And that's what you're going to do more often, I think. Well, thank you all for being here. We appreciate it, and I hope to see you soon.